Hi, and welcome to AI Script to Screen, a podcast dedicated to exploring the very latest ways artificial intelligence is affecting every aspect of healthcare communications. Some episodes will be my own reflections and thoughts based on my commercial experience, while others will feature guest appearances from leading voices across the healthcare industry. Scaling scientific storytelling, AI video for complex medical communication. There's a quiet irony at the heart of modern medicine. The science is becoming more precise, more personalized, more extraordinary. And yet, the way we communicate it often struggles to keep pace. Protein structures predicted in days, gene therapies tailored to the individual, diagnostic systems learning in real time. The velocity of discovery is accelerating, but human comprehension has not sped up in quite the same way. Clinicians are busy, investors are cautious, patients are overwhelmed, regulators are vigilant, and somewhere in the middle of all of this, pharmaceutical and biotech teams are tasked, with explaining mechanisms of action, clinical trial outcomes, risk profiles, and therapeutic pathways with clarity and accuracy. Not simplistically, not sensationally, but responsibly. And this is where scientific storytelling becomes less of a marketing exercise and more of a translation discipline. Because complex medical communication isn't just about communicating data, it's about creating understanding. And understanding requires structure, pacing, and emotional intelligence. For years, scaling that kind of storytelling has been difficult. High-quality medical animation and video production required long timelines, large teams, significant cost. Every update meant re-rendering, re-editing, sometimes even reshooting. And localization added further layers of delay. Meanwhile, the science moved on. AI changes this dynamic, but not in the way many people assume. It doesn't replace rigor, it doesn't make compliance optional, and it certainly doesn't remove the need for experienced oversight. What it does do is remove friction. Rapid prototyping of mechanism of action results, or MOAs, faster iteration when medical reviewers request revisions, efficient localization for global markets, adaptation across formats without rebuilding assets from the ground up. In other words, AI allows medical communication teams to scale without sacrificing precision, and precision matters. In pharmaceutical and biotech contexts, credibility is fragile. Oversimplify and you risk mistrust. Overcomplicate and you risk disengagement. It's a delicate balance. My own background sits at an unusual intersection. Decades in production leadership working with global pharmaceutical organizations, alongside more than 30 years in behavioral psychology. That combination shapes how I think about scientific communication. Because data alone rarely persuades. People need cognitive clarity, they need narrative scaffolding, they need visuals that make abstract processes tangible without distorting the science. When done well, AI-supported video becomes a way of honoring complexity rather than flattening it. Take MOAs. Traditionally, these required extensive modeling, long render times, and substantial budgets. Updates were cumbersome. But with AI-enabled workflows, teams can explore visual metaphors early, refine them quickly, and move through the approval cycles more efficiently. The science remains intact, the compliance guardrails remain firm, but the production timeline compresses, and that compression has strategic consequences. It means medical affairs teams can respond to emerging data more swiftly. The marketing directors can align global launches more coherently. Investor relations teams can articulate pipeline potential with visual authority. And perhaps most importantly, it means patients receive explanations that respect both their intelligence and the emotional reality. Because patients aren't passive recipients of information, they're active interpreters. They bring fear, hope, prior knowledge, cultural context. Scientific storytelling that ignores this human dimension risks becoming sterile. AI does not supply empathy, people do. But AI can support the scalable delivery of empathically designed content, and that distinction matters. There's a temptation whenever new technology appears to frame it as revolutionary, to declare that everything has changed overnight. In truth, what we're witnessing is subtler. The fundamentals of good medical communication remain exactly as they've always been: clarity, accuracy, credibility, and respect for the audience. What has changed is the production model. It allows teams to build systems rather than one-off assets. It allows scientific storytelling to expand across regions, platforms, and stakeholder groups without proportionately expanding cost or overhead. Scaling in this sense isn't about volume alone, it's about sustainability. If your organization needs to communicate complex science quickly, accurately, and with grounded human insight, AI video can become a disciplined advantage. Not because it replaces expertise, but because it extends it. And in a world where discovery moves fast and trust remains hard-won, that extension may be one of the most important strategic decisions a pharmaceutical or biotech team can make. Thanks for listening to this episode of AI Script to Screen. I hope you found the ideas interesting. If you'd like to discuss any AI video or animation projects in healthcare, or any other sector, please don't hesitate to get in touch. Thanks.